All
Well,
right.
if we have a few more folks joining us now that we've got our technical difficulties sorted. Kayla and Blake, would you be so kind as to quickly introduce yourselves?
Yeah. Blake, you go ahead.
Okay. Well, hi guys. I'm Blake. I'm one of the psychologists here, and Kayla's the other one. San Jose Psychology. We've been doing neurofeedback here for a long time, and currently we've got 4 locations throughout Alberta that we work from. Yeah, Kayla, introduce yourself.
Okay, yeah. So as Blake said, we're both registered psychologists. We co-own and operate several different clinics in the city. We have, a combined total of 20 or more years of experience in the field of psychology, and specifically with neurofeedback, which is a whole kind of specialization in and of itself after the completion of the degree requirements and the licensing exams and everything like that. So we use technology and neurofeedback to help get good client outcomes. And that's what we're excited to talk with you about today.
That's awesome. So guys, if you want to get started on just presenting some of the basics, that would be amazing.
Yeah, so we thought that anxiety was a good topic to discuss because so many people tend to struggle with anxiety. It's a fairly well-known common affliction and word out there in the general public. So we thought, let's discuss this, and specifically, let's get into how it works from a neurofeedback perspective or from a brain science perspective. So
Yeah,
we're gonna, go ahead, Blake.
it's really exciting because we're getting really good results with what we're doing. And a lot of people haven't heard about neurofeedback, don't even know that it's an option. And so this is really what we want everybody to know about.
Yeah, so we're going to look at what is anxiety, how does anxiety look in a brain scan or in different brain scans, what is neurofeedback, and then what is the success rate at our clinics, how it happens, etc. So yeah, let's just jump in.
And throughout the process, if you have questions, you can just write them in the comments there. And we'll try to get to answering as many of those as we can afterwards. And so, but all throughout, you can feel free to put in some questions in the comment area.
Okay, so what is anxiety? I feel like everybody knows this word. Everybody has a possible individual definition of this and what it means for them. But at its basic level, anxiety is a natural response to stress, uncertainty, or potential threats. So it's basically when our nervous system is in a bit of a heightened state because we are sort of scanning the environment and making sure that we are looking for all the possible threats or stressors and responding to those threats or stressors, to ensure the best outcomes, basically. But sometimes our system gets really good or too good at anticipating threat when there actually isn't a lot of threat there. And so some anxiety is normal and some of our reactions to stress are good. We need that. We need those kinds of reactions. But sometimes it gets a little bit excessive. And so, the normal physical, emotional, behavioral responses to anxiety would be things like, physically, it would be like your heart is speeding up or racing. You might feel like you're taking kind of shallow, quick breaths. You have like a whole situation in your body that feels tense. You can get cold extremities, those kinds of things. Emotionally, you're obviously feeling, a little bit nervous, anxious, overwhelmed, maybe on the verge of tears, that kind of thing. Behaviorally, usually the first reaction to anxiety we always want to do is to avoid, right? Avoid the stressor, avoid the stimulus that is, creating this feeling. But we know from, what we do in our treatment that the best thing is not to avoid, but we'll get more into that. So there's all these kind of like cascade of effects that happen in our nervous system and then how it's sort of presented outside of ourselves or within and outside of ourselves.
And yeah, I like how you broke it up into those 3 separate things. Like I would say for me, understanding that's really important, because when I experience anxiety, it's like I'll feel something in my body. And sometimes the only thing that I'll notice is my hands are a little bit sweaty. And I'll be like, but I'm not nervous. Well, I guess I am if I'm having some sort of experience to this. Or maybe I'm just, really irritable and angry and like, well, not recognizing, well, I'm actually anxious and nervous or stressed about something. So it's good to recognize all those three different kinds there, three different pieces of anxiety.
And I think, sorry, Blake, just going back to that last bit, I think one thing we didn't maybe mention there or say out loud was the cognitive component of anxiety. So that's all the worry and the thinking part of anxiety that can happen. Sometimes that has to do with past experiences, and sometimes that has to do with future experiences. So it's like the past experience, it would be like the rumination and the like, oh my gosh, I can't believe I did that in that interaction with that person earlier, like, oh, so stupid or whatever. Future thought patterns can look like the what ifs, what if this, what if that catastrophizing thinking. So I guess that's like an important thing to mention that can happen with anxiety too.
Yeah, that's a good point. I notice a balance between the cognitive or the thinking part, how rational we are, and then there's the emotions, and or how rational and how emotional we are. We want a good balance between those two things, but anxiety kicks us off balance. For sometimes we're just so emotional, but that we're not very rational, or some people will just become so analytical in their stress that they leave out the emotion too. We really want to be able to have a good balance there. Now, Kayla, I have to warn you because you and I had talked about adding the two of the different types of brain scans that we'll see with anxiety.
Mm-hmm.
There's actually a lot of different patterns that we'll see. I just added a third one for you there to talk about as well.
Okay.
Yeah.
Okay. Awesome. And I guess I want to just say this. I love using like analogies and visuals, which we're going to talk about in just a moment when we look at this slide. But to the point about the rational versus kind of like irrational stuff that happens with anxiety, I think that when we think about it on a brain level, there's this concept of the upstairs and the downstairs brain that I'm pretty sure it was Daniel Siegel who came up with this like sort of analogy initially. And it's all about how, like, when you look at the brain, there's like this downstairs part of the brain, this lower part of the brain, which is like the brain stem, and here like the limbic system part of the brain, which is like our emotional system of our brain. And then the upstairs brain is the top sort of frontal cortex, more thinking parts of our brain. And sometimes when we have excessive nervousness or anxiety, not just like the normal kind that would be like good to have if like I'm writing a test and I want to be a little bit nervous because I care and I want to do well, but not too much to the point where like I'm shaking and having panic and I can't think anymore. And that's because the upstairs and the downstairs brain, think of it like a little staircase there with a doorway, and it gets disconnected. The door shuts closed and you don't have like nice access between the two. You become either super emotional, or like Blake said, it can go the other way, super like logical, rational without the emotional component, and they're not talking to each other as well. So that's just another, consideration to have when we're talking about anxiety. When it comes to brain scans, which we'll get into a little bit more too, what we do with our neurofeedback, but basically we look at a whole head of a person, and we record their brain waves at the baseline when they first come to us, and we say, what is going on in this brain? Like, what's just the baseline here? Somebody's saying they're having anxiety or experiencing nervousness or fear or trauma response, etc. But what does this actually look like more objectively? And so we take a look inside, and these three examples here on this slide are showing three different, but sometimes interplaying anxiety, like observable characteristics of anxiety when it comes to the brainwaves. So the first one is the excess high beta. So high beta brainwave is 23 to 38 hertz. And we have three circles within each of these images because we always look at 1 minute with eyes closed, 1 minute with eyes open, and 1 minute doing like a kind of easy, but still a task of some kind. So it's like some reading, some silent reading. And what we see here, if we had our little legend of colors, we would see that anytime we're getting beyond about the blue colors, when we start to get green, yellow, orange, and red, if we were to see red here, that's just getting higher, 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 higher on the spectrum of the percentage of how much of that particular brainwave is being produced at that time of measurement, at that recording time. And so here we can see excess high beta. It's like getting higher in the region of the brain around here, because it's bird's eye view, these circles of the brain, and it's getting higher at eyes closed, that first circle, but then it really heightens at the second and third circle, which is the eyes open and task. So every time a person kind of gets into any kind of an alerted state beyond just sitting with eyes closed, relaxing, we have a ton of 23 to 38 hertz, right? High beta. And that is, high beta is just at that amount is just not very efficient way of our brains operating. It's saying, it's kind of like the threat signals coming online and going like, uh-oh, this is not good. There's a threat here in some kind of way. Yet the person is just kind of sitting in the chair, in a nice cozy office with a lovely staff member, so theoretically there should not be really any threat to this, but the brain, this one is showing that the brain is interpreting this as threat. So that would be one way that anxiety can show up. The second
I would add, this is actually exactly how I would want this brain to look like if you're in a building that's on fire. That's how we want the brain to look.
Yeah.
But Keela's right. When we're doing this assessment, we make a really relaxed environment. And if we're seeing the brain acting like that during a relaxed state, then we've got an issue.
Yeah. So then we get to the imbalanced high beta. So same idea, high beta is not generally what we want to be producing when we're in a safe atmosphere. One thing, if we're like, in the fiery building or running across the street in a car, we're just dodging the car that's racing at us or something like that, fair time to produce that, but not in our brain mapping sessions necessarily. And if we are, then we just know it's like an issue and we're going to do some brain training to help out. But the imbalanced high beta looks like this. You can see, especially at the task condition, which is the third circle. Yeah, there's quite a lot on the right side, frontal right side of the head versus the frontal left side of the head. And so when we have imbalances like that, we can definitely get the felt sense of something's amiss. I'm not at ease here. I'm discontent with something. I'm not like doing okay and functioning okay. Blake, do you want to add anything to that?
Yeah, that's exactly right. We want to have a reasonable balance between the left and the right hemispheres, typically about 10% variation because they are different. Just like I use my right hand for some things and my left hand for other things. But generally, we want them pretty similar with a little bit of variance. But when there's this much variance between them, we've got some issues.
Yeah. Okay. And then the third way that anxiety can show up, and these aren't the only three ways, like Blake said, but these are like just very common patterns to see, is slow wave, slowing, especially over the anterior cingulate area of the brain. So the kind of like that midline, that frontal midline area. And as you can see, there's a lot of 2 to 4 hertz in this range. So 2 to 4 hertz is actually a very slow wave that our brain produces. It actually dominates when we're sleeping, or should be dominating when we're sleeping. And if it is showcasing high amounts in our waking time, then we have a brain that's not like activating and coming online to the external experience as much, and very much you can get that felt sense of in your own head. So anybody who says like, I'm just always in my own head, like I can't like, pay attention to what someone's saying because I'm just constantly thinking about, my own self, my own sensations, my own worries, the what ifs, all that kind of stuff, that is very much conducive with that slowing, and especially the slowing over that anterior cingulate area.
So the important thing to notice here is that sometimes we're seeing too fast brainwave. Sometimes we're seeing too slow. Sometimes it's an imbalance. It might be the connections in different locations. There's a whole bunch of different ways that it can present in these brain scans. Not all anxiety looks the same. Typically, if you go to see a doctor, or even most psychologists for that matter, they don't do a brain scan. And they will assess based off of questions that will be asked of you or people that know you. And how well are you at this? How much do you feel this? How much this? And you rate it. And yeah, I'm anxious. I'm always thinking about these things. Anxiety is the diagnosis that you get. We actually have 11 different types of anxiety in the diagnostic manual that we use, but they're all based off of the presenting symptoms. They're not based off of the presenting brain scans or what the brain's doing. And as such, depending on which type of anxiety you have, we don't have, it doesn't do a good job of guiding which types of treatments or what types of medication to use for the most part. But when we actually take a look and do a brain scan, then we can identify specifically what's going on. Two people might have similar issues with anxiety, but their brain scans can look differently. And so the treatment that we would do for one should be different for the other based off of what their brain scans are showing. And I would say this is the big thing that we do here at our clinics is neurofeedback. After we've taken a look at these brains, we will find the areas that aren't functioning properly. And neurofeedback is a way to train the brain to function better. So that happens by giving feedback on what the brain is doing. And that feedback happens in real time. Okay, so if we're seeing too much of those high beta waves that we talked about, those really fast brain waves that we want in emergency situations, when there's too much of those, we want to train the brain to have less. So we'll monitor those brain waves. And we see every moment that there's a little bit less, we'll just give the brain a reward. Maybe the volume of what you're hearing will get louder, saying, good job. Or the image that you're seeing on the screen will get brighter, or Pac-Man will move across the screen when you're doing more of what we want. So reducing those beta brainwaves. And then when we have more of them, which is not what we want, maybe the volume will go quiet, or the screen will go fuzzy, or Pac-Man will stop, one of those things. So we're just giving real-time feedback on what the brain is doing. That's how we go training the brain, and it really is that simple. The things that we're noticing, it's so helpful for anxiety, number one, depression, ADHD, sleep issues, stress, concussion, autism. Like, we could go on and on with the wonderful things that we're seeing it helpful for, because really it is about training the brain to function better. And think about it, if your brain's functioning better, like, what isn't going to improve? So many different things can improve from neurofeedback.
Yeah, and it's like we look at it from that individual perspective that Blake mentioned earlier. So it's not just like when you go to the doctor and you say, I have anxiety, and they say, okay, let me throw you on a SSRI or something like that that's meant to help with sort of depression, anxiety based stuff. And it's just kind of a blanket. This is kind of the best treatment that we have for any variation of anxiety. What we do here is we say, let's look right at your brain and look at exactly what is causing the problem here. And then let's train those areas to say, don't make as much of that 23 to 38 hertz at, this location versus that, or don't make as much of that 2 to 4 hertz at that anterior cingulate location, et cetera. And we help the brain to make its own changes in the way that it needs to make changes, because we've seen the actual individual problem within the individual brain. And then that is where we get the phenomenal results, which I think we're going to come up to in a slide or two from here.
Yeah, that's right. I'm really excited to show about the results that we're getting here. And Kayla, I'll let you describe the process a little bit before I get into the results.
Sure. Yeah. So, I mean, we've kind of already said it a couple of different ways, but we always start with an assessment, which includes that brain mapping you can see there, but it also has like a structured interview with the psychologist, computerized cognitive tests, and mental health questionnaires. So we combine a lot of information. We're combining objective data with subjective data and a person's qualitative experiences, and we're putting all of that together to create a really individualized set of protocols for a person. Then a person would, well, I guess before that, they would review the results. We'd go over it and say, yeah, look at all this delta, look at all this high beta, whatever's going on here. It's not you, it's your brain. It's okay. Let's get you set up for some training. We would then have the person complete their training sessions, which is usually about 20 as a starting point. Sometimes that's enough for people to achieve their goals. Sometimes we review the progress and we decide on something else. But basically, it's the neurofeedback training sessions and then the progress assessment. And the progress assessment is exactly what you see in number 1 there, with all the same things. So we get to see the differences not only in the brain maps, not only in your lived experience, but also sometimes people's cognitive scores get significantly better. And they're like, wow, that's amazing. How did I get better with my working memory? Like, that wasn't even a thing that I thought I had a problem with or was wanting to get better, but it did. Or they'll go from, like, you know, severe or moderate or severe, you know, numbers in their depression or anxiety down to like mild or none to minimal, that kind of thing. So it's really cool to see all the results that happen after this process.
So I would say for me, my second favorite appointments are that initial assessment when we're reviewing the results, where we are able to see, hey, what's going on, identify, and I find like young kids and teenagers especially are like, holy cow, you can tell all this about me. I find a lot of adults too that have been suffering with things for a long time will like just break down as they're able to finally have that data on the screen, that brain scan on the screen that can actually pinpoint where the issue is coming from. That's my second favorite appointment.
Mhm.
I would say my favorite appointments are when we do those progress assessments, because that's when we get to not only look at where you were, but after doing some sessions, now where are you at? And seeing the results. And at the beginning, we're showing a few of the comments that people make. But regularly, every week, people are telling us just the most amazing, life-changing things. And I mean that on the regular. We're hearing just fantastic things about how neurofeedback is helping people. And a very, very simple thing for a client to come in and be able to participate in, but phenomenal results. And let's jump into that, the results that we're seeing. So what this here is, the anxiety measure that we use, questionnaire, and this was based off of 62 clients from our clinics that were suffering with a high or severe or extreme level of anxiety. And among those people, just the ones that did 20 hours of neurofeedback, when we do the follow-up assessment, 91.9% of them measured a decrease in their symptoms. So it's not 100%, but it's pretty close. I think a more because people will often come and ask, like, well, is this going to help? I've got anxiety. Is this going to help? And probably. I think the bigger question is really, how much is this going to help? Like, is this going to help me a little bit? Is this going to really change my day to day, or is this absolutely going to change my life? I think that's sort of the bigger question. What's going to happen? How is my brain going to respond to this? And we wish it were 100%, and we work so hard to get as close there as we can, but it's not 100%. We do have some, but it says here an average decrease of 8.9 points. And if you can see the colors in the background, so up here is like extremely severe or extreme level of anxiety. Here's severe. This is high, moderate, and then mild to low down here. And an average of 8.9 points, you can see here on average it was close to 23, which was severe. And then afterwards, our average was about 15, which is mild or moderate. Hang on, extreme, severe.
Mild. It went to mild.
It went to moderate, mild. Thank you. That's right, to mild. Now, and we do see some that, you know, of course, there's some within this that are from the most highest level of anxiety to just totally nothing afterwards. We see a lot of these people seeing these great results too. It actually happens. When I compare this to research that we see for what we call the gold standard, which would be medication for anxiety and CBT, cognitive behavioral therapy, a form of counseling. What we're seeing for those on average, it's about a 4 to 4.5 point decrease in anxiety. What we're seeing on average is more than double that from at our clinics is what we're seeing. And one of the things that when I try to present this data to clients to help them sort of gauge expectations, often I hear, yeah, do you know what? But I've tried so many things. I'm going to be in that 8%. I'm going to be that one off person that just doesn't respond. It always seems to be the way that it goes for me. Remember that the clientele that we are working with are what I would call the treatment resistant. They're the ones, we're not the first thing that people try. Like the overwhelming majority of the people that come in have already done lots of different medication or been hospitalized or have done counseling and different therapies and all sorts of things, yoga, retreats, whatever, like so many different things. And then they come to see us. So we're working among that treatment resistant. So this really, really high rate of improvement is among those people that often think they're not going to get results, yet we still see these incredible results. And I want to compare to, there's a study using the same measure that we use for anxiety. This was a private hospital in Australia, looking at it. It was a psychiatric hospital, people with anxiety, and they would measure their anxiety before and after. And you'll notice before, okay, they had a little bit higher, on average, but their decrease is almost identical. Now, let's remember, we're seeing about the same results here as when they're hospitalized on average for 14.9 days. And the treatments that were offered, acute care programs, group therapy, interpersonal psychotherapy, cognitive behavioral therapy, psychiatric care, so medication, and is not psychiatric care like you would usually get if you were to go see your family physician or even a referral to a psychiatrist. When you're in the hospital, they're there constantly monitoring with nurses, making sure you're taking the exact dosage to get that right. On all measures, this is like the peak of the best type of care that we're able to give for anxiety. Yet we're noticing at our clinics within 20 hours of a couple visits a week, we're seeing the same results here for treating anxiety. It's truly phenomenal, the results that we're getting. And we just wanted to share this with the world and let everybody know, like we have data that we've collected over the years, and we really are seeing this good results. Now, this is the short little presentation we prepared for you. Now, have there been any questions? I think Alicia would be the one monitoring that.
Yeah, we have a few questions from our live chat and some that we had just generally come up over the last few weeks that were applicable. So the first question would be, do kids experience anxiety the same way as adults?
Do you want to answer that one, Kyla?
Yeah.
Kyla, whatever your name is.
You had an Australian accent there. So, okay.
Just repeat the question in case I didn't.
Okay. Do kids experience anxiety the same way that adults experience anxiety? Is that it? Yeah. Okay. Sometimes kids can experience anxiety the same way adults do, with the things that they think, the worries, the fears, the not sure about something new, etc. But a lot of the time kids will experience anxiety in much more of an embodied way than adults do. So they'll have somatic symptoms and complaints, like physical symptoms and complaints. So stomach ache, headache, general feeling of uneasiness or shakiness, which can sometimes be hard for kids to language or explain with words. And so that's oftentimes what will be some good indicators for kids that are having some excessive worries, fears, anxieties, is those physical symptoms symptoms, nightmares, sometimes bedwetting and toileting can come into play here, either going a lot or withholding. There's lots of different things that can come up physically for kids, but they definitely experience it more physically than cognitively a lot of the time.
And so if we had kids experiencing those kind of somatic symptoms in the body, is neurofeedback something that could help support them in improved sensations of anxiety?
Yeah, so can neurofeedback help with improved physical symptoms of anxiety? Wholeheartedly, yes.
Absolutely. Yeah. Yeah. Just time and time again, people are consistently telling us about these improvements in their children, and you're right, it's those somatic complaints, the embodied complaints. They're not complaining about headaches anymore. They're not throwing up before school. They're not wetting the bed anymore. And things that we didn't even know, like bedwetting is a common one that we hear afterwards. It's like, we didn't know that was happening. But as we improve, particularly those theta brainwaves, I noticed, but as we improve the brainwave functioning, things function better.
Yeah.
Yeah. Next question.
Okay, and the next question is, Blake, when is anxiety good? We talk about like too much anxiety, but like, why do we have it at all?
Yeah. And so I think this is a really good question because let's separate anxiety and stress here. What I'm talking about when I say anxiety, it would be the presentation, how the brain, body, and behaviors and thoughts react to our stressors. Now, I would say it is a good thing to happen. And there's actually research showing that our thoughts about, is this a good thing or a bad thing, is a huge predictor in how healthy and how long we're going to live and how happy we're going to be. We need to come to terms with this anxiety response is our body's natural response, and typically this is a good thing that we want. Now, the question you want to ask yourself, is this getting me closer to my goals, or is this drawing me further away from my goals? Is this helping me, or is this hurting me? And as well as others, is this helping others or hurting others? And so when our anxiety the night before a test is helping us to stay awake and helping us to hyper focus on what we're reading, that's a wonderful thing. But once it starts to get too far and we're breaking down and, oh my gosh, I'm crying and I can't think straight and I can't even remember my name. How do I spell my name for this test? And when this starts to happen, well, then clearly it's not a good thing. So it's not so much if anxiety is a good or a bad thing. It's how we manage it and how it presents.
I found a really useful technique on this in this regard. Because it's true, like if we reframe it for ourselves in our own mind as to like anxiety isn't inherently bad. So every time we're experiencing some heightened physical, arousal or whatever, and or having thoughts of worry and concern about something that's going to be happening in the future or whatever, it's like instead of immediately appraising that as this is bad, this is bad, this is bad, like I don't like this is uncomfortable, then we almost create this like self-fulfilling prophecy of you're thinking it's bad, it is bad, it's going to be bad, you're stuck in that cycle. So I like to kind of say to people, try to reframe that as just labeling it for what it is. Like, yeah, I'm feeling nervous right now, and that's okay. It's normal to feel nervous before I go into a big exam, or I'm nervous that my husband's an hour late coming home from work when it's a blizzard outside. Like that is a normal, natural response. And the next thing I like to suggest people do is ask themselves one question, and that is, can I tolerate this right now? And most of the time, a person's response will be like, yeah, I can tolerate it. Like it's uncomfortable and I might have to like put some supports in place for myself to help myself calm and relax, call my husband, make sure he's good, review the last few minutes of my whatever's coming up on my test, etc. Like, yeah, I might have to put some things in place, but yes, it is tolerable. Like I can do this, I can handle hard things, I can do hard things, and I can be with uncomfortable sensations and symptoms without it being catastrophe.
And in the same way that anxiety, like, is it good or bad? Well, it's both. And with brain waves, I wouldn't say that there's good and bad brain waves. Actually, they're all important. They're all good. We just want good control and flexibility of them. We just don't want getting stuck and not having control of them. And that's really what we're about with neurofeedback, training the brain to have better control and flexibility over how our brain's working.
100%.
That's fantastic. Okay, we've got another great question here. How does lack of sleep affect the brain?
Yeah, so what we notice is lack of sleep will have too much of the slow brain waves throughout the day. Those are the brain waves we want to have during deep stages of sleep and at night. And what happens if during the night we have too much wake time and not enough, then they sort of blend together, that we're sort of in the day, we're sort of awake, but also a little bit too asleep. Interestingly, chronic issues with the lack of sleep can, during the day, we build up cortisol, the stress hormone. And as we sleep, we want to wash it out. And if we're not getting good, deep stages of sleep, that doesn't happen very well. And then our stress overall can linger and build.
It compounds too, right?
It compounds, yeah. And it affects our memory as well. Now, over the last 20 years, on average, teenagers specifically are getting, on average, getting 2 hours less of sleep per night. That's not per week. Every single night, they're getting on average 2 hours less of sleep. And what we're noticing is overall, we're seeing a lot more of these slower delta and theta brain waves and brain scans when you compare groups of children today versus groups of children in the late 90s. So it's a measurable thing that we can see in those brain scans. And we can clearly see the difference that it makes with performance and functioning as well.
Anxiety and mental health, anxiety and depression rates are on the rise massively for children and teens.
Yeah.
And I'll just mention here, I'll just throw into this about like what can lack of sleep do to a brain and how does it contribute to anxiety. Every time we have this excessive amount of slow wave in our brains, we have symptoms that are matching that level of arousal. So we have what we call under-aroused brains, and symptoms of under-aroused brains are difficulty with focus and concentration, brain fog, highly emotional, easy to react to things that you otherwise might have a lot more resilience for, right? So those, you combine all of that together, and then the domino effect that those things have in, like, you know, your day-to-day life, your work performance or your school performance or whatever else, and the compound effect, enter anxiety, right? That's kind of the easy way to think about it.
Fantastic. I think we have time for a couple of more questions, and I have a few more here in the chat. So we'll just go on with these next couple here, and then we'll wrap up our presentation for today. Next question is, how do I know when my anxiety is not normal anymore? Like, when is it too much?
How do we know when anxiety is not normal?
Because people, I notice people who have had anxiety throughout their whole lives don't know that. Yeah. And they're not going to be able to tell themselves. They need somebody else to help them find that, figure that out. And we notice that too, because when they notice improvements with neurofeedback, it's like this kind of like this eerie thing. It's like, well, hang on, should I not be worrying about these things right at this moment? And it's almost like, no, like it's okay to not always be worrying about things. But for some people who have experienced it their whole lives, or as long as they can remember, they don't often notice it, and it's other people that can help them notice. So if you're having people comment that your anxiety seems to be too high, or if you notice you're too irritable and things like that, then yeah, but the easy, yeah.
Honestly, I think the easiest way to like measure it is with tangible things that can be sort of noticeable. So like I call this like, you know, behavioral indicators, I'll say, right? So like, yeah, you can be irritable and kind of agitated and heart racy and clammy all the time, but like maybe that's normal for you. Maybe you've always had anxiety and that's kind of like always been. But where you can really pick up on the difference is, okay, I used to also be able to function with all of that and like, you know, run my life and run my schedule and run my family's life and perform reasonably at work and, you know, kind of get by, right? And when those things start to slip, that's when you can really say like, you know, it's okay to like reach out for help and say, I think this is now affecting me more to the level of like, I can't actually function anymore. I'm not able to do the usual kind of daily stuff that I was before, or that other people seem to be able to do, and I cannot seem to be able to do this. So that's when you can say, check it out. Let's go in and talk to a psychologist or get a brain scan or whatever, right?
Yeah. It can be the other people. It's one example I like is one client that came in and was sort of against his will, somewhat like it was an ultimatum given to him. If you want to get married, you have to go and do some neurofeedback here at San Jose State Psychology. And he's like, okay, I'll do it. And I was asking him how things were going after a few sessions. He's like, no offense, but this is not my thing, you know, and I don't think it's going to do anything for me. He's like, but I can say now that I've started doing this, at least my fiance, at least she's off my back about things. She's not bothering me as much. And he kind of chuckled that, okay, I guess that worked. And then he thought about it. He said, actually, her daughter's been a lot less annoying too. And actually, do you know what? Come to think of it, everybody at work has been nicer as well. And so he didn't realize until that moment when it's like, well, hang on. Did everybody in the world all get better at the same time? Or do you think it might be that's when it finally clicked for him? And that's a real testament to us that anxiety, like he'd just been living with it and we'll project it onto other people in other situations. Well, yeah, I'm grumpy today because the roads are bad. Look how much, you know, and it's not that I hate bad roads, it's I hate the bad drivers. And, you know, you hear these things and it gets disguised through other ways. And we try to think that it's not us experiencing anxiety, but the world around us isn't going the way that we like it or the way that it should.
Yeah.
Fantastic. All right, and I think the last one. Oh, hold on. Oh, okay, this actually is really great. There's lots of us who are high functioning and anxious people. Sometimes meds can be a really good quick fix and keep us going forward. So how does neurofeedback compare to taking an anxiety medication that might be quite successful for the individual?
Well, I mean, I think both methods of treatment can be helpful and somewhat effective or really effective for people. We never like downplay any particular thing. What I would think of as the comparable is that medication is going to be faster acting, but also faster to not act once it's stopped. So it's literally just working at the time that it's in the system and the person is taking it and so on. And then there's other issues with like, you got to find the right dose and the right one, and it can be trial and error and there can be side effects, but we won't get into any of that. Let's just keep it simple. Neurofeedback is going to be take longer to have the desired effect. You know, it takes a bit of time for the brain to learn the skills, if you will, or the patterns of functioning that we're sort of asking it to do. But once we've created that new way of regulating and having control and flexibility in the brain, it doesn't unlearn this over time. So it's pretty permanent and lasting type of change. Sometimes people can benefit from some further sessions or, you know, maintenance sessions, booster sessions, whatever it is, that's fine. But that's how I would distinguish kind of like the meds versus neurofeedback. And we've had people who come in and they're on meds and they're like, have no desire to get off of meds, just want even better functioning, even though they're on their meds, and we could try to achieve that. We have people who come to us and say, can you get me off my meds? And we always say like, we're not prescribing physicians. We technically can't do anything with your meds, but we have seen very good success for people to be able to possibly drop or get off of meds, working closely with their prescriber, etc. So yeah, it's like, I guess that's what I'll leave it at.
Yeah, another neat thing is whether medication was helpful or not has no bearing on whether neurofeedback will be helpful or not. And same thing goes the other way. And also with counseling, if medications helps or not, it doesn't mean counseling will be good or not. And neurofeedback, the third thing, like they don't overlap in that way. So it's a completely unique way to treat anxiety that I think people need to learn about, know about.
Mm-hmm. That's a really good point, Blake. Like, don't be hesitant if you've had negative experiences with medications or counseling or whatever it is before. Like, that doesn't really have a great bearing on how effective neurofeedback could be for you.
Amazing. Thank you so much, guys. This has been fantastic. I don't think we have any other questions. So if you just want to wrap up, we're all good to go.
Okay. Well, I hope everyone has an awesome weekend and stays warm if you're in Calgary and it's currently -15 and snowy. And we hope to be able to jump back on in about a month's time and do another webinar. I think our next one, we're gonna have a topic around depression, possibly, which is a good timing, I think, because we have all the seasonal depression stuff that's going to be surfacing for people if it hasn't already. So, yeah. That's it. Okay.
Bye.
Bye.